Hey, I'm Juliana and I'm gonna talk about 17 movement today in the video. The first movement is flexion. It refers to a movement that decreases the angle between two body parts. As we can see in the video the man is doing, and hinge joint is the one that being used in this movement. The structural is synovial and the functional is diaphoresis. The specific bones used in flexion is humerus, ulna, and radius. The muscle used in this movement is bicep brachii, brachialis, brachioradialis. Extension. It is the opposite of flexions, a straightening movement that increases the angle between body parts. It also uses hinge joints and the specific bones, and the muscle is exactly like flexions. The structural is synovial and the functional is diaphoresis. Abduction. It moves the limb laterally away from the midline of the body, and motion occurs within the coronal plane and involves medial lateral motion of the limbs. Condylar joint is used in this movement. The structural is synovial and the functional is diaphoresis. The muscle used in this movement is abductor brevis, abductor longus, and abductor magnus. The anatomical movement represents our femur, fibula, and tibia. Adduction. Adduction is opposite movement with abduction, and it brings the limb toward the body or across the midline. The structural is synovial and the functional is diaphoresis. The anatomical movements are exactly like abduction, or femur, fibula, and tibia, or the muscle used in this movement are abductor brevis, abductor longus, and abductor magnus. Condylar joint is also used in this movement. Pronation. Pronation describes a rotational movement of the forearm that results in the palm facing posteriorly. And pivot joint is used in this movement. The structural is also synovial and the functional is diaphoresis. The bone used in this movement is radius and ulna. The muscle used in this movement is brachioradialis, pronator teres, and pronator quadratus. Supination. Supination describes the motion of turning the palm anteriorly, and the joint in use are a pivot joint. The structural and functional are synovial and diaphoresis. Radius and ulna is also used in supination movement, and the muscle used in this movement are bicep brachii, supinator, and brachioradialis. Oppositions. Opposition is the thumb movement that brings the tip of the thumb in contact with the tip of the finger, and the joint in use is the saddle joint. The bones used in this movement are trapezium carpal bones and the first metacarpal bone. The muscle used in this movement are opponens pollicis, abductor pollicis, and appostus digiti minimi. And the structural is synovial and functional is diaphoresis. Circumdation. Circumdation is the movement of the body region in a circular manner in which one end of the body region being moved stays relatively stationary, while the other end describes a circle. The joints used in this movement are shoulder and hip joints, and the structural and functional are synovial and diaphoresis. The muscle used in this movement are pronator teres, flexor carpi radialis, palmaris longus, palmar aponeurosis, flexor carpi ulnaris. The bones used in this movement are humerus, femur, dorsal, and neck bones. Elevation. Elevation is upward movement of the scapula or the mandible. The joint in use are scapula or mandible joints, and the structural and functional are synovial and diaphoresis. The bone used in this movement is humerus, scapular, clavicle, or the mandible. The muscle used in this movement is deltoid and the masseter muscle. Depression. Depression is downward movement of the scapular or the mandible. The joint being used is also scapular and mandible. The structural is synovial and the functional is diaphoresis. The bone used in depression is also humerus, clavicle, scapular, or the mandible. The muscle used in this movement is lateral pterygoid and the lower trapezius. Projection. Projection of the scapula occurs when the shoulder is moved forward, as when punished against something or throwing a ball. The joint being used is the scapular joint, and the structural and the functional are synovial and diaphoresis. The bone used in this movement is the scapula, The muscle used in this movement is rectus anterior, pectoralis major, and pectoralis minor. Retraction. Retraction is the opposite motion, with the scapula being pulled posteriorly and medially toward the vertebral column. The joint in use is scapular joints, and the structural and the functional are synovial and diatherosis. The bone used in this movement is also like projection is scapula. The muscle used in this movement is rectus anterior, pectoralis major, and pectoralis minor. Dorsiflexion. Dorsiflexion occurs when the ankle bends, raising the toes upward, and this decreases the angle between the dorsal side of the foot and the tibia, and the joint in use is the ankle joint. The structural is synovial, and the functional is diatherosis. The bone used in this movement are fibula, talus, and tibia. The muscle used in this movement is tibialis anterior muscle. Plantar flexion. Plantar flexion occurs the ankle bends in the direction that points the toes and plantar side of the foot downward, and the joint in use is ankle joint. The structural is synovial and the functional is diatherosis. The muscle used in this movement are soleus and gastrocnemius. The anatomical movement are fibula, talus, and tibia. Inversion. Inversion involves the movement of the sole towards the median plane, so that the sole faces in the medial direction. The joint used is subtalar joint. The structural is synovial and the functional is diatherosis. The anatomical movement are tarsal bones of the posterior foot. The muscle used in this movement is tibialis posterior. Eversion. Eversion involves the movement of the sole away from the median plane, so that the sole faces in the lateral direction. The joint used is also subtalar joint, and the structural is synovial and the functional is diatherosis. The anatomical movement and the muscle are the same as inversion, is tibialis posterior muscle and tarsal bones of the posterior foot. Rotation. Rotation or rotational motion is a circular movement of an object around a central line. The joint used is pivot joint. The structural is synovial and the functional is diatherosis. The bone used in this movement is vertebral column, and the muscle is external oblique, rectus abdominis, and lumbar multifidus. We just go through the 17 movement. We get to know what the bone used in that movement and what the muscle used in that movement and how does that movement work. And we get to know the structural and the functional. But basically all the 17 is like the same structural and functional. It's synovial and diatherosis. But I hope you enjoyed the video and thanks for watching.